So benefits of this endoscopic approach, the endoscopic technique offers many advantages compared to traditional open surgery because the incision is so small, 7 to 8 mm, there is less damage to muscle and tissue. That means you will typically have less pain after the operation and only a tiny scar in the back. There is usually very little blood loss during surgery or no blood loss during surgery, and the infection risk is lower since the exposure is very minimal. Patient also recover faster. Many can go home the same day or just one night in the hospital. Overall, endoscopic spine surgery achieves the same goal of removing the herniated disc with a far less trauma to your body and much quicker return to normal life. How different is thoracic surgery different from open and endoscopy? In open surgery, for example, if you want to do a disc surgery, just imagine because of the rib cage attached to the spine, we need to cut open the bone, expose the multiple levels of thoracic spine. Either you go from the back or from the side or sometimes through the thorax. So the big 10 to 15 centimeter incision is given. Sometimes the rib has to be removed. Sometimes lot of bone has to be cut. Muscle has to be traumatized. And sometimes we have to enter the chest also. So such is the difficulty in operating thoracic spine in open surgery. But with the latest technology of endoscopic spine surgery, the endoscope precisely goes to the disc area without damaging these tissues with a tiny hole that is the size of a pencil. You are there with the drilling of 4 to 5 mm of bone and you are there. So as a result of which, comparing open surgery of 20 centimeter in thoracic spine, here we are only putting a 7 to 8 millimeter of incision. That's a huge difference where patients need a thoracic spine surgery for disc surgery. Then endoscopy adds a tremendous advancements compared to open surgery and benefits a lot to the patient. Recovery, what do we expect? So recovery from endoscopic thoracic disc surgery is typically much faster and easier than after a traditional open surgery. Because the incision is so small and we didn't disrupt much muscle, he will likely be up and walking soon after the procedure, sometimes within few hours. Many patients go home later the same day or after one night and you will have some back soreness, but it's generally manageable with mild pain medication. At home, you will need to avoid heavy lifting or strenuous activity for few weeks, but you can get back to light activities and short walks when you feel ready. Most probably within few days you are up and walking for your routines. Outcomes and final thoughts. Endoscopic thoracic disc surgery has high success rate in relieving pressure on the nerves and reducing pain. Most patients experience significant improvement in their symptoms and are very satisfied with the quicker recovery. As with any surgery, there are small risks like bleeding and infection, but complications are very less and uncommon, especially compared to traditional open surgery. Overall, this minimal invasive approach allows you to get back to your life faster and with less discomfort. It's a state-of-art technique that achieves same goal as old-style surgery, but in a gentler way. Always feel free to discuss any questions or concerns with your doctor so you feel comfortable and informed about your treatment.